Okay, Doc.
Okay, so the third question is, thanks to you, Dave, for providing this content! Exclamation point. There's one of a kind out there, and there are so many of us that are aching for good info. The question for Dr. Rand: I'm 65 years old, have been active athletically my whole life. I've been on TRT for about 5 years using a compounded cream. Would you please contrast compounded creams versus injections? Sure.
Hold on, I want to say
Okay.
something. This is so cool that we get people that are that age. You know, it's very, very
heck
cool
yeah.
that it's not. Isn't it great?
Well, and still active athletic.
It's
That's
awesome.
as it should be.
Yeah.
I mean, I go off on a big tangent there, but
It's
the very
awesome.
definition of life includes movement. So,
Yeah.
This gets circular. If you don't have the T, you don't feel like moving,
Yeah.
and all
Yeah,
that
yeah,
sort of
yeah.
thing. So,
Yeah.
this is an easy one: cream versus injection. I probably have fewer than 6 people in my practice. I'm not going to tell you how big it is, but I've seen a bunch of people. 6 people who are using creams, because if I can talk you out of it, I'm going to talk you out of it. Why? Let's start with the practical. It's a royal pain in the butt to have to apply a cream every day, and it's bad enough we have to use shaving cream every day, right? Or at least Monday through Friday. Some people cotton to it, and that's great if you can do it. And actually, I joke all the time. Women. My wife, I should have bought stock in Sephora. I'd be getting some of my money back. They're used to applying creams and they don't blink. That sort of thing. And I shouldn't be. I don't mean to make it sound sexist at all, because guys put on sunblock and all that stuff. But it is a royal pain in the butt to have to put it on, wait 5 minutes for it to dry, another 25 for it to be at least close to fully absorbed before you can sweat or jump in the pool or something like that. And then of course remembering to bring it with you on vacation.
Mm-hmm.
And some guys might be single out there, might not feel comfortable, on a date, a 4-day weekend with their girl and bringing this thing on. So I mean, there's tons of reasons. I can get into more than that to get more specific, but you get the point. So practically not so good. But how about medically speaking? There's a reason why you have to put on the creams every day, because your testosterone is going up and down like this, right? When you're using an injectable, a time-released form and a esterified form of testosterone, you're going to have a peak and a trough, but you're going to stay therapeutic that whole time, because as soon as you drop back down to here, you're going to do another injection, and you stay therapeutic 24/7. You never drop down too low. And you say, well, I can do that with a cream too. I'll just use a bigger dose, or I'll dose more frequently, which is pretty much the only way you're going to do it. There is a limit. We've gotten it up to 300 milligrams per ml, which is normally 200 milligrams per ml, using some special techniques that I have to thank a couple of the pharmacies that I work with, APS and Empower Pharmacy, figuring out how to pack more in there. We've also used DMSO to help deliver more of what you got through the skin. But again, we're dealing with the same thing. It's a pain in the rear end. And again, medically speaking, it's better to have therapeutic dose 24/7. Is it the way we work, normally or naturally? Heck no, but it's a heck of an improvement. And then you ask anybody who's gone from a cream to an injection, can I say this 100%? I'll say almost invariably, just to be safe. They'll tell you, oh yeah, it's way better. I don't know anybody who works with me anyway who's ever said, well, I want to go to a cream from an injectable. There's some who don't know, they haven't gone to the other side of the door yet and don't
Right.
know any better. And this is where it's kind of sad, because you see people, they get a dose, a modicum of improvement for even a few hours. It's still better than the low T they had, and they go, oh well, this stuff works. It's better. It's great. Whatever. But the problem with that too is it can be at such a dose, and you can do this with injectable too if you don't dose it properly. You can like the gentleman before this question who was doing 380 every 2 weeks.
Yes.
And then he dropped down below, felt crappy,
Nice.
and his endogenous production has now been decreased by the fact that he's using some form of replacement. Right? So now that second week is even worse than before he started. And ditto for some people who are using the creams, they get a benefit for a few hours, but by the next morning their testosterone levels are actually lower than before they went and started testosterone therapy. So
Yeah,
not
sense.
a big fan of creams. I made that a lot longer than it needed to be. I'm sorry, but across the board, injections for sure. When's the best day to apply? best time of day depends on what works best for you, and I don't mean that to be a smart aleck answer. It just really does depend. Your testosterone levels start to rise in the morning, so arguably you could put on before you go to bed, but you could also put it on first thing in the morning, or some people will say I'll put it on before I go to the gym at 2 o'clock in the afternoon.
Yeah.
Really, it depends. And because it goes up and down so much, again, with whatever works best for your schedule and your liking. Let's see. I guess I stopped after that. Okay. If a guy is using, sorry, I didn't read the rest of the question. You're probably asking yourself, what was he responding to? If a guy is using creams or other topical applications, when is the best time of day to apply it? My thinking is several hours after awakening would be best because my endogenous testosterone peaks very soon after waking. It makes sense to me to not apply it and dampen my own body's testosterone. To apply it later seems it would extend the higher blood level for longer during the day. Okay, just to drive this point home, your own endogenous production has been reduced. If anything, it had you don't have the same endogenous production. If you're using anything that's affecting you beneficially for even a few hours, it's definitely decreasing your own endogenous production. Think of it like a contraceptive. It doesn't take a whole lot to tell your body, oh, well, if you're making it for me, then I'm not going to make it anymore. So that you got to throw that whole theory out the window, if you will, because you've already dampened your own production. Period. There's no better time. Okay, does that make sense?
Yeah.
As a side note, my libido has been great up until this year. My main benefit from TRT has been regaining some of my sense of giving a crap. When I'm not on TRT, I'm a slug that could care less about anything aside from binge watching garbage TV. It's about time that men's HRT is brought out of the shadows, and this service is invaluable. Thanks to both Dr. Rand and Dave. Well, thank you. Most appreciatively, Rand Whitney. Well, this goes back to the previous question about HCG. That's one thing you could consider with your libido to help improve it, is to try and get your endogenous production back up again, which has probably been hammered by now. Been on for he's 65 years old.
Yeah, I was going to say.
For 5 years. And also, again, let's check to see where the estrogen rests, because it might be oversuppressed. Mm-hmm. And all this might be resolved once if he's willing to try the injectable testosterone. We get the levels up high enough on a consistent basis that this isn't a problem anymore either, because maybe the decrease in libido is because the testosterone levels are too low for most of the day.
Right. Very cool. Thanks, Doc.